We are presenting at the American Society of Hematology meeting this year results of the M1564 trial, which is a study looking at the combination of daratumumab with venetoclax with or without Velcade in patients with relapsed multiple myeloma. This study had two cohorts, part 1 and part 2. Part 1 looked at patients who have 11-14 multiple myeloma, and part 2 was for all comers, including non-11-14. Interestingly, the study was based on the rationale that venetoclax is targeting BCL2, which is highly dependent or highly appropriate in myeloma patients with 11-14 disease, but also the rationale that adding Velcade can sensitize myeloma cells to the effect of venetoclax. In addition, the daratumumab was thought to be able to target non-11-14 dependent clone, and that's the rationale behind the study. Importantly, on this trial, the results showed significant and deep responses. In the part 1A of the study, which combined venetoclax with daratumumab, the overall response rate was 95%, and 94% of these responses were very good partial remission or better. Similarly, in the part 1B, the response rate was also close to 90%, with almost 75% of these patients in very good partial remission or better. And most importantly, unlike the result of the Bellini study, we haven't seen any treatment-emergent death or infection resulting in death on this trial. So the safety profile appears very promising. Hence, the study now is reopening and expanding in patients with 14 myeloma, and we look forward to the further maturation of this data with longer follow-up.